Hello and welcome to 91 Podcast, where we share deep and meaningful conversations that help educate, inspire, and encourage us. Today's topic is something that's of great importance to each and every one of us, no matter where you live, no matter if you're rich or poor, and that's the issue of healthcare. And today we have a nurse who's going to share his thoughts, his knowledge, his wisdom, and his experience with us and help us understand more about the healthcare system here in the UK. Welcome, Mr. Osawaru Enoruyi. It's great to have you in studio with us today.
Thank you. It's a privilege being here.
So, Osawaru, you're a nurse, but many people have this belief that nurses are female. So what's it like being a man that's a nurse?
Yeah, your question is quite hilarious, but it is what it is. I do not even intend to be a nurse.
Oh.
Because I've never heard a man being a nurse growing up.
Okay.
I've always known or knew that female are nurses, male are doctors. Then I also venture into other things, like going to other institutions where I study medical laboratory. I was in the hospital doing my IT, where a nurse approached me and said, "You could be a nurse. You will do well if you're a nurse." I was hesitant in the first time. They'll say, "Does men do nursing?" They say, "Oh, there are men who do nursing." There are men who do nursing. Men can actually excel more than female in the field.
And where were you told this? Was it in Nigeria or here
in Nigeria, in Benin City, in Upper Sapmomba there.
Okay.
So I went to the school. I actually saw men in the department, men in the school, but they were few though. When I got the admission to study nursing, we were about 100 in the class. We were 8 boys.
Okay.
So,
8 out of 100.
Yeah.
And why is it that there are more female nurses in Nigeria than male nurses?
Because everybody know that female are nurses.
Why? What shapes that thinking?
It is the information available. I think that's why we as male nurses need to do more in educating the public that, look, men are needed. Not just men can do nursing. Men are needed in nursing in different areas. In terms of the energy you bring to the job, men are naturally stronger in terms of resilience, in terms of working long hours, in terms of being able to bottle your emotions and get the job done. Then in terms of leadership as well, men are needed because we have seen where our nursing profession in Nigeria are, and we think or we feel that if there are more men in the profession, we will compete at the highest level of professionalism in terms of Nigeria context, whereby we see other courses that are more predominantly men, and they will be ranked higher than nursing because they are more female than men. So we are encouraging men to come into the profession. Then we that are already in the profession, we are being encouraged to aim higher, get higher, and then we can take nursing into greater heights, I think.
Okay. It's funny you mentioned leadership because I didn't think, I felt like nurses, well, I know I'm used to seeing female nurses. I felt nurses were led by the doctors, and so they didn't need leadership. They just had to follow. And I always felt like maybe nurses were women because they had to be soft, they had to understand, have emotion, had to be, loving. So I guess that's why even me, I think, okay, nurses are mostly women.
Is that what you think?
Yeah.
So it's a different profession. We are not under doctors.
Okay.
Nurses are under nurses. So doctors are on their own. Like medical laboratory, they are on their own. Radiologists, they are on their own. Ophthalmologists, everybody have hierarchy in their own setting. The same way nurses are. We have our own hierarchy. We have directors of nursing, senior nursing officer, chief nursing officer. Then we also have people we listen to. We also have hierarchy that talk to us. Then we have command chain, information chain, all of that. So in the hospital setting, it tends to be, doctors are the head, which is the professional hierarchy of the organization all over the world, though, not only in Nigeria.
Okay.
All over the world, doctors take the lead of hospital hierarchy. What I mean is, even medical laboratories, scientists, radiology, all of them, they are under doctor, because in all of that, the doctor will be the center of who take the decision, where the decision goes to. But he will get all the information from the nurse. Let's say, for instance, a patient is admitted. Doctor will ask, has he opened bowel? Has he passed urine? Has he eaten? Those information are data collected by the nurse that will aid the doctor to make informed decision, or say, okay, this is where we want to take the direction, the management to.
Okay.
So that is how it is.
That's how it works.
So, yeah, that's how.
Is it true that doctors look down on nurses and that doctors are more important than nurses?
Yes, for the first one. No, for the second one. First, doctor look down on nurses in Nigeria because of the broken system, as I said earlier. Is the ego stuff that says, oh, we are the best. Who are you to talk to us? The kind of vibe you get from the streets. Who are you? After all, doctor make more money, dress more better, look good, because nurses are on uniform. The doctor is on blazers and all of that. And they definitely. So that already creates a different social strata for everybody. So in Nigeria, once you are on a higher social strata, you look down the others. That's what it is. That's why you see a lot of incident of doctors slapping nurses in the hospital for flimsy stuff, for just no important reason. It's not that they are fighting because they want to take care of patients. They are fighting because of ego. Okay. Then when I say no on the second one is, doctors are not more important. Neither is nurse more important. We are on different profession. Doctors is to diagnose and bring up a plan. But those plan is gathered by data that are gathered from the nurse and also other investigations. The job of a nurse is to care by implementing scientifically proven plan, which is first designed by the doctor, then nurses back it up with their own knowledge. Let's say a doctor says, this patient has heart failure. The nurse knows that it should be nurse in the cardiac position, or semi-recumbent, as we call it. So it's not the doctor that is going to tell me, nurse, the patient is semi-recumbent, or cardiac position, as they call it more in Nigeria. It's out of my own knowledge of understanding the diagnosis and the plan of the patient. So you say that we are not, sometimes doctor may not even know. If the doctor is new, you say that if I have 5 years experience and the doctor, although he has first class, but he just came back from school, he's going to learn from me.
Yeah.
Because I have been on this job, I know everything that patient can present with. He only know theoretically, and he has not even do hand-on experience. So in that instance, the nurse is more
important,
intelligent, is more knowledgeable.
At that particular instant.
Yeah. However, the education for both is quite different. We are not taught the same thing. I am taught to care. They are taught to profile diagnosis. So it's a different profession.
So, Mr. Osawaru, I believe you mentioned that you were trained in Nigeria.
Yeah.
Don't you feel a bit guilty contributing to the so-called brain drain in Nigeria? I mean, you've come here with skills, knowledge, understanding that were all given to you in Nigeria. So don't you feel guilty that you're contributing to the brain drain?
No, don't feel guilty.
Why is that?
Because before I became a nurse, I was human. I was a citizen who also desired the best thing of life.
And didn't Nigeria give that to you?
That's where the issue is. I was talking with my colleague. I said, if I was working in Nigeria and they pay me 1 million, I don't think I would consider coming to the UK. Because 1 million naira would be enough to comfortably live well with family of 3 and make sure. Even as at the time I came to the UK, my earnings was not up to 500,000. At least it was
500,000 a month?
It's not. That's when you said, okay, you are a man, not because you are a nurse, but you are a man. You have to provide. But if you say, okay, you want to do nursing exclusively or totally, like the way we do it in the UK, whereby I'm a nurse, I don't do any other job. I only do nursing. If I'm to do that only, like I got a job in UBTH and I'm working only in UBTH, I can't feed properly. I can't feed my family. I can't be able to provide all they need because the salary is too small.
How much exactly were you making a month in Nigeria?
Okay, if we were to look at the salary structure of a nurse, a BSc holder coming in will be paid right now around 200,000, which is like £100
a month.
A month. So if you're going to stay in one job, in that job, that's okay, I'm going to be doing my 35 hours in this job every week in a month, and you go on with 200, you can't really feed when you have a family of 3 kids with husband and wife. Let's say the way it is in the UK, husband is working, wife is working. Let's say the wife is also working and we are combining. That means we're going to talk about childcare and all of that.
School fees.
School fees and all of that. House rent, lights, you're providing everything. Then you're going to service the car, you do all of that. You see that practicing nursing in Nigeria will really make an impact in my life, let alone affecting those around me. So that's the major reason why I decided to say, okay, I had to come to the UK to make more money.
How were you managing in Nigeria?
That's the Nigerian spirit. As a Nigerian, you have to find a way. We do other job. We visit other clinic to do other job. Like some of us, we also have little clinic where we can, because as a nurse as well, you are qualified to own a clinic in Nigeria. So I own little clinic where I also see few patients to keep the book balanced. So I really did not like the way the life was going. That's why I gathered some resources to say, okay, I'm going to come to the UK. Unlike some people who were fortunate enough to be sponsored directly from Nigeria to the UK, whereby you apply, you write some exam, CBT, ITS, then you got the job, they sponsor you, you come to the UK. I didn't follow that route. I came to the UK via visiting visa, did my OSCE, pass, look for a job, got the job, they gave me sponsorship. I came back to Nigeria, do another visa to come in. So that in itself is a lot of money. But I'm doing that in order to break even. Because in the first 3-6 months, all the money I spent, I've made it back, pay all the loans I took to
in
get
6
it done.
months.
Yeah. So in all, I would say is basically because of finance, of money. Nigeria is not paying us nurses professionals as they would. And that is what is fueling the migration. But safe to say, though, migration did not start today. Social media accentuates the migration.
Can you explain that a bit more?
Okay. What I mean is people have been migrating
From Nigeria.
But most of us are not aware because there's no means of sharing that information except the local media, NTA, EBS, ITV, and they won't even talk about that. They are busy talking about government and all of that. They won't talk about, okay, let's give an example. My uncle in the 60s came to the UK to study.
Okay.
It's because the economy was better then they had to come back to Nigeria. And a lot of people, our president was in the US. Tinubu was in the US working. So immigration did not start today. Social media make it popular that everybody now are aware. Yeah. Like if I make a tweet in my village, Mogunokwa in Orion local government, now in the next few seconds, somebody in America will see it. That's how it is now. Unlike, I know a lot of people that traveled then. After like 5-10 years, before you will be aware that somebody in that family traveled. So now, social media is making it look like, oh, there is a rave of travel.
Everybody's escaping.
The UK travel route has been on since 2003. This come to UK, find a job, do a ski, then get a sponsorship has been on for over 15 to 18 years or more. So it's not 2024, it became a rave.
Something that's been going on.
People have been moving. Like in our profession, we get this information that people are moving. There are a lot of traveling routes, opportunity. That's what even gave me the idea that if you become a nurse, you actually have a passport to any country in the world.
Because you are needed, you are valued.
Yes. My uncle, who is still in Sweden, called me that, oh, can you become a nurse? Then I was in Aushi Polytechnic. Can you become a nurse? I said, okay. Uncle, do men become a nurse? As we said before, do men? He said, yeah, just look for nurses that was 2006. Nurses are needed all over the world. Try and become a nurse. I didn't go and get it, though. Until I begin to see friends who migrate to South Africa, migrate to Dubai, migrate to UAE, migrate to UK, Canada, America. That is, in my set, I can say I will be like, let's say, almost the last person to leave. I have a lot of friends we graduated together that have been in the UK, US, Canada for a very long time before I migrated.
Before you left. And when you compare your working conditions here to your working conditions in Nigeria, what's it like? Are there any differences?
Yeah, there are a lot of differences, wide differences.
How?
The working condition here give you the confidence, joy to come to work, that you don't even consider the 12 hours. It comes so fast. Okay, let's say, for instance, it is dignifying to be, well, how will I say it now? To improvise. You are a smart nurse to improvise in Nigeria, but you are not a smart nurse to improvise in the UK.
Can you explain that a bit to me?
Okay, let's say you want to sell cannula in Nigeria. There's no tourniquet. which a lot of hospitals don't have tourniquet. You can use hand glove to tie the patient's hand, take the blood. You are applauded. You are improvising. At least you get the job done.
Using hand gloves.
Yeah, to tie. But here in the UK, you are dehumanizing the patient because the tourniquet is available abundantly for you to use. So if you begin to improvise unnecessarily, it becomes a crime, and the patient can take you off for it. So because of that, it becomes easier that when you walk, you know everything you need is available. It becomes enjoyable. It becomes fascinating that you are looking forward to the next day. And apart from that, every day you go to work, you're making money. You are happy that sometimes I feel with the rate at which I go to work and the energy and the passion I put in, if I put it in Nigeria and I'm getting the money, I will stay in Nigeria.
Some people may say that your example that you just gave is not the view of all hospitals in Nigeria. That I'm sure there must be some hospitals in Nigeria that have every single item that you need.
Does not exist. They can. My email I open, I'm still alive. They can bring it up. Let's go check the hospital and see if basic things like syringe, like needle, like tourniquet are available.
Are you saying that there's no hospital in Nigeria that has every single medical item?
What you need, it does not exist. It does not exist. If you don't find it in hand gloves, you are finding it in other areas like drip stand.
Why is that? Because I'm sure there's some hospitals that maybe the extra rich go to that must have some of these
The one
things.
the extra rich go to, the equipment, the basic things are available because nobody uses it. And most time it go bad. I've worked in hospital where ultra rich go to. You have the equipment. They don't even have who to use it on. That may be an exception, but still, it's not available all the time. Like if they have hand glove and they can argue they have hand glove, do they have MRI machine? They should have. They have CT scan. Most of them don't even have X-ray. And still, we're talking of ultra rich. That means people that can pay millions.
Yeah,
Still,
politicians.
they won't have all it takes to take care of the same ultra rich. How many hospitals in Nigeria can we really say I have everything to care for for one singular person? If he got sick, there's a lot. Let me learn, there is echo, there is CT, there is MRI, there is ultrasound, there is X-ray. Apart from that, there are other investigations that as little as troponin that we can take. Oh, patients having chest pain, let's take troponin and check. There are a lot of things that is common here that don't really come common, even when they have someone that can pay for it.
Some people may argue that if your working conditions as a nurse in Nigeria, if they're so bad, why haven't all of you maybe come together, protested, forced the government to provide the things you need?
Why do you think there is a strike? There are different type of strike in Nigeria. First of all, doctors, they are on their own. They strike on their own terms. Then other health bodies, like the nurses, the laboratory scientists, and all of that, they also have their own strike. So that's why we say strikes are of different level. Then we also look at why are they striking? Why are they striking? Why are the staff saying we want to go on strike? Most of the time, it's not only salary. when you look at it, is the promise made by the government that have not been fulfilled. Let's be realistic. Let's check why. It's because the media will always say doctors, healthcare workers, nurses, they are on strike. They won't look into why are they on strike. Is it because of salary all the time? A lot of time is because of agreements made by the government, unfulfilled. You said you're going to provide equipment. You didn't provide the equipment, and you allow us to be working in an unbearable situation. Is one of the reasons they go on strike. So, over time, nurses and all other healthcare bodies have been trying to call government to do the right thing, and it always fall on deaf ears.
Has there never been a time that the government has listened to you and done something?
In my own observation, there's never a time till now. There's never a time that government will say, we're going to do this. They will do it.
But you guys are so important to the whole nation.
It's not even about nurses being important. The patients are more important. There's a saying that the patient is the center of healthcare industry. Healthcare is actually an industry on its own. Not, we see hospital as, oh, this is the healthcare. No, hospital is like the showroom. It's like the football pitch where everything you have is displayed. You understand?
Yeah.
Okay, I'm not sure you understand.
I understand. Don't worry.
Okay. Healthcare industry is big. The patient is the center. Then the showroom or where the main show happen is the hospital. I keep telling my state government that block and paint is not healthcare industry. And block and paint is not actually what make hospital. That is real estate. Anybody can do it.
Yeah.
But what make hospital is the equipment that is available to take care of the patient.
The medicine,
Yes, and that alone, when you look at it, you will see that healthcare industry is the hub of economy. The reason why Nigeria are not progressing as a country is because we don't have that singular healthcare industry in shape. Let me break it down. Agriculture will pass through healthcare because if you have patients, they're going to eat. You're going to feed them. The biggest hospital in the UK will amount to take care of about 2 million people.
Wow.
Not more than. That's the biggest healthcare institution. I mean, hospital. When you go to their website, they will tell you that we take care of 2 million people. That's the biggest. Like most of them is 500,000, 800,000, 1 million, as the case may be. That means a state like Edo State that has about 6 million people should have tertiary health care, a tertiary hospital of about 6 or 7. That's tertiary. We are not talking of primary. We are not talking of secondary. So that's on its own. Those things require civil engineer, mechanical engineer, electrical engineer to work there, right? You have automobile engineer because you need ambulance. You need agricultural sector to keep functioning because they need food.
Yeah.
Some patient will be on high protein diet. Some patient will be on bland diet. Company are going to make those food. Then we talk about electricity. It must be 24 hours electricity. Then we talk about education. Healthcare is 75% education, 25% the other things.
Okay.
But our government concentrates more on the 25%, which where the percentage of their concentration is not even up to 2%, which is the block and the paint. Okay, let's take example from what Brazil just did. Brazil did, say, if you look at the news 2 weeks ago, 1 month ago, all their oil royalties, they said 75% to education, 25% to healthcare, nothing else.
Wow.
So some people were saying, why will you say 75% to education? I know many Nigerians know this news, and they are asking, why are they committing 75% to education? They forget that healthcare is 75% education. The patient need to be educated. The nurse need to be educated. The doctors, everybody working need to be educated. Then the person educating them need to be educated. The person educating the educator need to be educated. You understand?
Yes.
That is why the place like India, they just sign agreements, graduate agreement with the UK to always send their graduate to UK to learn so that they come back and get the job done.
The government did that.
Government did that. That's to say, from the educational fund, they can fund those travels to go and get the information and come back
and improve their own healthcare.
All this information are not part of what is happening in Nigeria. And we complain that our healthcare is down. Government is not making the right decision. It's not making the right call to get the right result.
You mentioned, like now you mentioned, what country was it that did 75%?
Brazil.
75% into the education, 25% into the healthcare. What percentage goes into our own education and healthcare in Nigeria?
Healthcare last year, 2025, was about 1.3 trillion was budgeted. Guess how much was released? About 400 billion.
1.3 million.
Trillion was budgeted that, this is how much you are going to spend on healthcare. Then they release about 400 billion. And guess what they release it for? It's still salary.
Salary?
Yes, they use the money to pay salary. If you say, okay, no, it could not be salary, mention which hospital do they build 2025? None. That's to say, they are budgeted to pay salaries, not to upgrade the healthcare.
Equipment or anything in there.
That is even a bigger fish. When we're talking about healthcare, I think we diverted. Healthcare is an industry. And I keep saying that if government can make the right policy, our healthcare will start working. Right policy is simple. Free healthcare for all.
Can we afford?
We can. That's the issue. We can. Okay, if we say we can't afford, they have the Nigerian people not suffer enough. That over 130 million people are multidimensionally poor. That means they can't afford water. That's what it means. For 130 million people to be dimensionally poor, it means they can't afford clean water. You want those people to afford healthcare insurance. Because I will get the argument that there's healthcare insurance. Why are they not purchasing it? People that cannot get clean water want to purchase healthcare insurance. So if you have 130 million people dimensionally poor, multidimensionally poor, that's to say we have over 65% of our population not be able to afford healthcare. That means companies will not come to invest in healthcare. Because if you do, you won't have sales. You won't have patients. No return on investment. No return. Because imagine you get a loan from UK to invest in healthcare, and then you have CT scan, MRI, then in a year, only 100 people come to use your MRI machine, which is not even enough to service the machine a whole year. So if there is policy saying, let there be free healthcare for everybody, I am sure, certain that all citizens will access healthcare institution. And when they access, the building, the block and paint won't fall apart. Because why are they falling apart in the first place? No usage. Because if there's usage, it won't fall apart. That is why if the government can get the policy right to say free healthcare for all, I can tell you, many people investing in other industry will come to healthcare because that's a good mind.
Yeah.
If I can treat 1 million people in a month, that means I will have more money to pay for equipment. Then the equipment company manufacturer like Siemens, Samsung. Do you know Samsung is manufacturing healthcare equipment?
Really?
Yeah. They manufacture healthcare equipment, Samsung. Siemens, Idon, Menstrom, a lot. They will come to Nigeria to start the company or say, okay, you don't need to, even here in the UK, nobody buy hospital equipment and pay outrightly. They supply, they begin to pay every month. Then when the equipment, when there's a new version or the got by, you replace it, you continue. It's part of the plan. So you will not go, how many can we say? It's easy. If they make the policy right to say, let there be free healthcare, I can assure you a lot of people, a lot of Nigerians in the UK, in diaspora, will come to Nigeria to invest in healthcare, and then we can begin to see improvement.
Wow. I'm just thinking, with all the taxes Nigerians pay, even like in Lagos, for example, almost every bridge there's a tax, pay this, pay that.
Yeah.
I'm just surprised that nothing is going towards healthcare.
They are not prioritizing healthcare. I think that's why I want to come to the podcast. At least it's not every time we begin to bash government, we begin to be negative about our country. Some other time we should bring facts, should bring insight to the table for them to also understand, okay, this could be it. Can we try this if what we have been trying is not working? I think that's what most Nigerians, in my opinion, should be focusing on. Yeah, you've been in this country, you got this experience and all of that. So instead of you now become negative about our country, why don't you bring the positive to the table? Let's see if government would like to adopt it. That is why we are saying, no matter how much is in the country or coming in or being tasked, if they are not prioritizing something, it will not work. So it's not about how much do you have. It's not about how much is being spent. The question is it spent on priority? Do we see that, our country deserves to have free healthcare? Let's pump the money there. Let's put the money there.
At least it might stop all our rich people from going to other countries whenever they're sick.
No, yeah, a part of it though. Because even in the UK, there is private hospitals. It's not everything. There's reason where the English word private has a meaning. It's not privately owned. We think when it's owned by somebody, not government, that's private.
Yeah.
Private means exclusivity.
Wow.
The rich in the UK don't attend public hospitals. They go to private. You know why? It's exclusive. They go in, they come out. Unlike you are booked for surgery in the NHS. 3 months, 4 months, you are still on the list.
You have to wait.
You have to wait. But you go to private hospital, you are getting it done now. You are going home soon. You get back to the business. You are back. Nobody knows what is happening. Unlike you suffer first for the next 6 months before they will say, okay, it's your turn. You will receive a mail that, oh, you have an appointment coming, then they will book you in. That is where the private comes in. They have private secondary schools, private university, private club, private. It's not owned by private or non-government people. That's what make it private. It's owned, it's there because it serves exclusive people. So when we are saying, oh, yes, if everything is okay, because I got this argument too in Nigeria that, oh, wow, if government decide to do free stuff, even the rich will be taking. They forget that if we do private, if you would do free healthcare, it would not stop queuing. It will not stop the wait. You understand?
Yeah.
You understand? It will not stop it. Still, can Dangote want to wait? Can Otedola want to wait? Even I don't want to wait. When I was in Nigeria, my child has tonsillitis, adenotonsillitis. I called my ENT doctor who was working in UBTH. He said, oh, this is where my daughter has. He said, okay, go and do X-ray and do full blood count and send it to me. He said, we need to do the operation. Can we do it tomorrow, 6 a.m.? I said, yes, bring it to my clinic. We got it. We did it. The child woke up around 9. We went home. Nobody knew we had the operation. My brother did not know about the operation till after like 2 years. That time my daughter has this, we did the surgery. That is exclusivity for me. But here in the UK, my child was sick. I had to wait in line. Even she was brought to the same hospital I worked.
And you still had to wait.
I had to wait. So if we say free healthcare, it will not stop the wait. We will still have to wait for our turn. But still, people that cannot wait will not go to private.
Those who have the money for it.
Yes, because you get the service on time, you paid immediately. That is what it is.
But what the free healthcare will do is make sure that people don't end up having to die because they cannot afford anything.
Free healthcare will make sure that whatever happens, wherever you are sure you will get healthcare.
Your life is being valued. Your life is being taken care of.
It is.
Because I remember some years ago, I was doing a documentary on Nigerian healthcare. And I remember going to some hospitals and seeing, even some places we went to, it was raining and some places were just flooded. The water, imagine having to walk through water that's all the way up to your knee just to get into a hospital. And going in there hearing that there's no water. There's no water, they don't have this, they don't have that.
The pump is working, not like to pump it.
And then seeing that in some places people bring in bodies and then the person has to just lie there because, oh, there's no this, there's no that, or there's no money to treat you. And some people just lie there till they even just pass on.
That's it. If we go to talk about in the interim, what should our people do? Get healthcare insurance, no matter how small it is. Like in Edo State, I know of healthcare insurance that is like 18,000 a year.
Wow.
It may not be able to take care of everything, but it will ensure that once you come, you'll get health care first. Before they will not talk of, oh, what you brought, what you came with is too expensive to be taken care of by the insurance. You need to pay this percentage. But before then, they would have taken you in. Nothing like go and bring card money, go and make deposit. They won't talk about that. You go in immediately and get care. So that's in the interim. But as I said before, Nigeria have gone through a lot to be talking about healthcare insurance. When we hear in the news 400 billion stolen, billion stolen. What will it take to now say free health care for people? And if there's free health care, to make it enjoyable, there must be standard education. It's education that make free health care easy in the UK. It's education. Because the next person knows that he need to wait for his turn.
There's order, there's a procedure that you must follow.
Those systems are built on education. That, for instance, there is what they call PID protocol. Is as a result of research, and then it become proven that when you give these 3 antibiotics together to treat PID to be functional. Let's take it to Nigeria, where people don't know about education. You are telling this patient to say, okay, you need to buy this. The fact that they cannot afford it means that that protocol has no place. Because how much is this? You say, oh, it's too expensive, we can't afford this. Is there any other alternative? When you begin to think of alternative, where I say, earlier I said improvising.
Yeah.
When you begin to improvise on things that shouldn't be improvised, there's no longer system. There's no longer system. System means that there are set rules that people follow. Come rain, come sun. Whoever is there, whoever is watching, nobody will do out of that tenet.
Yes, and even if they do that, they will be punished for it.
They will know there's consequences. Because if you know that this patient has PID in the UK and you don't follow the guideline, you're going to answer for it.
Is that why you see some situations or hear about some situations where someone might go to the hospital in Nigeria and, the doctor says, the person should go home and pray about their issue?
Yeah, because what it takes to get the patient to health is not affordable. Imagine a MRI scan is about 200, 300 plus. And you sometimes, here in the UK, you see that they will do like 4 MRI for a patient. Oh, let's go and check the head. Let's go and check the chest. Let's check the pelvic. Let's go and check the spine. That is an MRI. Okay, imagine you have to do that. That's already about 1.2 million first. Then we will now say, okay, let's go and do CT. No, we need to do CT to confirm what this is. And you were talking about doing 2 CT, 3 CTs. Then after that, you are now talking about, there is a consultant in Igbobi, and we are in Benin, that we need to contact about this. Because, that's what we do. We can be in SS. The consultant that need to see that patient is in London. So those documents need to be sent to him. He need to review. Then he will make recommendations. He will say, okay, let's do this, let's do that. All of that costs money, costs NHS money. But because it's NHS, it's easy. Now, when somebody is paying, it's more difficult. It's going to pay.
Yeah, you have to choose what's most important to you, because you might not be able to afford everything.
Yeah. So you see a situation whereby something happens, and okay, let me make it easy. There was a situation in social media. Somebody slumped. They begin to pray. Here in the UK, somebody slump. What do?
You call ambulance immediately.
You see, because they know what is available to use. Nigerian too, we know what is available. Ambulance is not available.
But God is available for us.
God is available. So that's why you see people calling God instead of calling ambulance. Ambulance is not available. Even at that, sometimes you see, let's just make it easy. Anthony Joshua had an accident. Although some houses said ambulance came, But the picture, the video that was sent to her was them squeezing Anthony Joshua into a car to take
into
to
a
the
vehicle
hospital.
to go somewhere else.
Do you know that is deadly? Is the same God that saved Anthony Joshua, not whatever they do, because an accident victim have a special way of transportation.
You're not even meant to touch them in some cases. You're not supposed to touch them. You just call for an ambulance. You don't touch them.
Then professionals come and evacuate. First, if anything happen here in the UK, what we do first? You call police, call ambulance. Police will be the first to come normally. Then they'll safeguard everybody everywhere, make sure everywhere is calm, then pave way for ambulance to come and take the patient. You will see that they are strapping the person to the bed so that it doesn't move. Because the more you move, if you have spinal cord injury, more movement will cause more damage. That is why. What squeezing Anthony Joshua in a bid to take him to the hospital was a wrong move. But that is what is available.
I think it goes back to the thing you said about education, because not everybody's educated on what to do in that kind of situation.
That is why a country spending 75% on education knows what they are doing. They know what they are doing because they know the millions of Nigerians or the population need the education. I remember those days, the people used to come teach first aid in Nigeria for a token, sometimes free. I'm not sure it still exists. People have given up. I remember those days that you used to come teach swimming because it's a way of saving people.
Yeah, anything can happen.
But I'm not sure it still exists. People used to take swimming classes for a bit to say, if somebody drown, I should know what to do.
Yeah.
They still do here in the UK because it's part of the education we're talking about. But they don't do it in Nigeria. Nobody cares enough.
Is it that the government is the one offering these things in Nigeria, right?
No, it used to be private people who are passionate about, no, we should have this. People who are passionate. Over the years, passion for helping out of your pockets is dying.
Just compassion, love for other people.
It's dying because at the end you keep, I don't know what to actually say that are making people to give up on just doing freebies. But how long do we do freebies?
I think it's also the thing of carrying it all on your head by yourself. Because I know my mother-in-law, you know, she trained as a midwife, and she used to go to places and sit down and just teach new mothers for free out of passion. But obviously, this is something she was doing by herself. And now that she's had to pause back and, you know, focus on other things, I don't know if anybody else is filling in that gap and doing that anymore.
I can tell you. What the organization, the three most important thing in primary health care, number one is education. Number two is prevention. Number three is collaboration. Treatment is not even among. So treatment comes in down when you go through the definition. Education is the center of primary health care.
You mentioned, so education, I think you've explained that a bit about how everybody needs to know things to be able to know how to function in certain situations. The prevention you mentioned, so like teaching people how to swim in case your child falls into a lake or something, or teaching them what to do in case somebody, you know, there's fire, what to do to help a person. Washing. The collaboration, I don't understand. Can you explain the collaboration part?
Okay. In civilized society, people are paid to go out to be teaching people. Nobody's doing it for free. For out of passion. They are being sponsored. Even currently, there's a lot of sponsorship going on in the UK. If you want to be teaching kids about IT, you can get funding.
The government to support you,
So it's the same thing. People go around teaching kids how to swim, first aid. Those are money from the government.
Yes.
So if I decide to go to Nigeria and say, okay, I want to be teaching people first aid, that means I will need to fly in and out, airpiece. That's about 2 million already. I'll need to lodge. I'll need to organize. Then I'll need to go around the school locations and do all of that by myself with my money in order to pass that information. And government will be seeing it. They want to help me out of let's support him that he has been doing. Though that is not how it is done.
Because you're a citizen and you're contributing to society, so government wants to collaborate with you.
Good. In a sane society, there should be a place I should go and register my intention.
Yes.
And government will give me funding to continue. I can take that as my job because there's enough funding coming in to really fund my own life, pay rent, pay car insurance, and do all of that, and then still be able to live meaningfully. So why will I stop that kind of a job and go and do other things? So that's why we say education is the center of all of this we are saying. So a country invests 75% on education, knows what they need to do. Nigeria don't know what they need to do. I know a lot of people who started this educational pack to say, okay, we need to teach people this, we need to teach people that. A friend of mine is still in Nigeria, he's teaching young mothers about breast milk. He has been doing it for the past 5 years.
Wow.
There's never a day government official have seen and say, you're doing a good thing. Okay, let's do the charity job. On a normal, it's not supposed to be a charity. It's a job. It's part of the economy. It's creating value. It's creating educational value.
Yes.
You understand? It's supposed to go somewhere to apply and provide proof of what he has been doing, and then he will get funding
to
continue it.
Wow. Okay, you've mentioned that the government is not collaborating, helping these people, to do these things. But what about like NGOs that we're seeing in Nigeria? Aren't they filling in that gap?
I don't know if there's any NGO in Nigeria.
You mean you don't know if there's any?
Is it the VDM type of NGO? Or the one that renovates primary schools and all of that? I know I've heard the word NGO, but I've not really seen an NGO.
But I thought there were a lot of NGOs in Nigeria, even all these ones owned by Americans and all these Bill Gates, all these foundation, all those things.
They are like Bill Gates Foundation is into immunization, HIV, and all of that. And they get their funding from America, US aid, and all of that.
Okay.
So why I say I don't know if there's any NGO in Nigeria is I'm not really seeing what NGO should be doing that they are really doing. What I mean is you can tell us this is what this NGO is all about. You get funding based on your NGO. In fact, it's supposed to be government funding NGO. That's the truth. Check it. That's how it is. It's government. There is money earmarked for humanitarian services. That's where they go apply and get the funding. Then you can say get the fund from well-meaning people that love what you are doing and say, okay, I want to partner. But that's how it is. So NGO structure in a way to support healthcare education does not exist. We only see them on social media. Or say, okay, I'm teaching this. Is my way of giving out the information. And information is not comedy. Health information is not comedy. Although they said, we are doing it in order to get the attention of the people. But in the long run, people remember the comedy than they remember the actual information to make informed decision.
And I think that's also not very safe, because if you're functioning as a proper NGO, you have to go with government guidelines. So there's that assurity that what you're doing is right.
Yeah.
But if you're just pushing things through social media as comedy, there's no one there checking that what you're saying is the right thing.
It is. That's why I categorically said I've not really seen NGO, because I've been in Benin for all my life. literally, I only spent about 5 years out of Benin City since I was born in Lagos.
Wow.
Currently, I can't see NGO that is in Nigeria that will say, okay, I'm pushing forward health education. I'm pushing forward health equality to help. It's not about you say, oh, those that have this kind of health issue come, we want to do it for free. That's not that's not even part of it. Treatment comes last when you're talking about health. First, number one is health education. Because we need to be thinking about people being aware of what they need to do to prevent.
Yes.
The whole center of COVID-19 is hand washing. That is pushed via education. That, oh, this is how to wash your hand. This is what you need to use to wash your hand. This is how many seconds you need to wash your hand. That is education we are talking about. So until we begin to have NGO who say, okay, I want to really do health education NGO, not after that one they call treatment. Oh, if you, no. You can't, what you can prevent, what we can prevent, we are leaving it till when it becomes
last minute.
Well, yeah, that's
Speaking of NGOs, there's this, public view online. There have been a lot of stories flying online talking about how in Nigeria, we're being given vaccines by organizations like, Bill Gates Foundation and being used as, in a way, guinea pigs. What's your take on that?
Without scientific proof, every other thing is fallacy. It's just social media frenzy. We have seen what vaccination have done to African race, especially Nigeria. At a time, there was yellow fever.
Yeah.
And now Nigeria is yellow fever free. That is not achieved because we are super. It's because we had vaccination.
Okay.
Polio. If you remember, 20 years ago, 30 years ago, we used to have a lot of deformed people.
Yes.
And when you look down, it's polio. Because of vaccination, constant vaccination, a lot of vaccination, polio have reduced drastically. And in some states, a year, they won't record any polio cases. That is vaccination. So will you now say, okay, because one patient got the vaccine and trigger, then the vaccine is unsafe? No. Yes, even in the booklet, there's a caveat that it could trigger the disease. Because actually vaccine is actually attenuated microorganism of the virus or the bacteria. So if you are getting BCG, you're actually introducing
the bacteria.
Or polio, you're actually getting the virus. But what they are supposed to do is to help prepare your system to fight when it comes. You understand? Because studies have shown that patients without vaccination and patients with vaccination, they will fare bad, they will fare differently when they have the infection. If you have chickenpox vaccination, if you come in contact with the infection, you will dust it off.
Be able to fight it better.
Yeah, you fight it better. You get well on time. But someone without the vaccination will really be very ill. So that is why we are saying vaccination is a game changer. So it's not about conspiracy theory without proof.
So are you saying that there's no instances at all where, certain vaccines have been tried, in Nigeria that have not been, like, before using them elsewhere?
They don't try vaccine on people without knowing. So it's not government that sign the memo, the law, the documentation of say, come and try vaccine on my people. Before a person is used as a trial, he must sign the document to say, I want to be used for trial. So if there is a theory of say, there's some group who brought vaccine to Nigeria for trial, the question is that how vaccines are tried? Is that how they go about trying vaccines? No. They will tell you, do we have new vaccine? We want to try. Are you interested? You sign the document. Then you come in as a experiment organ, or let me put it that way. You sign in for it. Actually, it's individual. There is nowhere in the world where government sign for the full state
To be test subject.
to be tested, to be test subject. Okay. So it's individual. Even as we speak, people are signing in for it. So how do we manufacture vaccine? Is be different levels of testing. They will first of all test it on animal, test it on animals that are more that behave like human. Before they will not get their test subject to say, okay, come, let's see. You will sign that, okay, I agree to be part of the test.
I do see, like, sometimes they put out emails and they might pay the person to be tested.
It's not actually free. So it's not actually free. So if they said, Bigate or the rest or anybody bring vaccine to the country, which definitely means that there is somewhere somebody is being paid to use the entire population. But if that is not founded, we cannot base our arguments or our thoughts on social media frenzy. It had to be backed by evidence.
So when you walked into your first hospital shift in the UK, what shocked you, compared to your experience working in Nigeria?
My first day in the hospital was actually, we call it training day. You have you watched the movie Training Day?
No.
But there's a Washington.
I'm not sure if I have. I might have.
So what it actually means that you are a professional. You are being trained. Then they will say, okay, come and work with this person that is also trained like you, but he has been on this job for long.
Like to shadow someone in a way.
We call it shadowing. Yeah. But in the movie, they call it training day. So when I got to the hospital the first day, first thing that shocked me, they were telling me this equipment can hold 2 liters of water. You attach it to. We're talking about Optiflow. Okay. Yeah. In Nigeria, if we are giving oxygen to a patient, we put humidifier on top. It's just constant procedure. But here in the UK, it's not like that. If you are on 1 liter, 2 liter to 4 liter, we don't use humidifier. Then if you are now, if you need oxygen above that, then they will review and say you need an Optiflow. That means high oxygen, 15 liter, but it need to be humidified so that you don't have the side effects. So they brought this oxygen head, that's what we call it. And then they say you're going to attach this 2 liter of water to it. I said, it will break. Is it not too heavy? Will it not break? The boss, it all laughter.
They're laughing at you.
They're laughing at me. Say, you are new. Please come and have a feel of the equipment. When I have a feel, I confirm that, yes, it can hold 2 liters of water.
So you had never seen that happen before?
I've never seen that kind of quality of an equipment. That oxygen here can be that quality to be able to withstand the stress, the weight. Unlike what we have in Nigeria, that little heat to break off. So that was the day I knew that when we're talking of UK healthcare, we are not just talking about kind of a country because we say it's developed country.
Yeah.
They are developed country for a reason. That means equipment to the carton they use in bringing equipment is quality. That the carton can actually, you can see that there's quality in it. Compared to what we have in Nigeria, where we can't say we call it China made. I'm not shading China though. They are helping us the best way they can, but there's a lot of quality here in the UK in terms of equipment, in terms of what is available compared to Nigeria. That's what shocked me in the first time.
Even that oxygen, I know many hospitals don't even have it in Nigeria.
They're not good there. That's the story for another day. Oxygen is expensive back home. That is why we are saying, if we have a policy that's a free healthcare, there is a lot of industry that are going to come in
and benefit from it.
Yes, because a company needs to be producing oxygen as well. How many companies produce oxygen? The whole of Edo State has one company producing oxygen. The whole of Edo State that house about 6 million people, one company produce oxygen. Whereas oxygen is like air in the UK, right?
Looking back, what experiences in Nigeria shaped the kind of nurse and healthcare professional that you are today?
Looking back and looking forward as well, Nigeria, we ground you to be exceptional.
How?
Because you are trained in Nigeria to remember, hypothetically. Nigeria helped me to be grounded. It does for everybody. As any professional trained in Nigeria, migrated to UK, they will tell you, everything I know, I learned it in Nigeria. We come here to polish it. So what it means is Nigeria teach you to learn, remember, even without you having to see it in reality.
So is that like theory instead of the practical work?
There's practical, but the practical is half-baked because it's limited. Either it's limited in terms of equipment, or it's limited in terms of type of patient, or limited in the whole infrastructure available. That's on this side. But on the knowledge aspect, Nigeria give you both the one you need, both the one you don't need, because they feel you might need it. Like currently, if they are teaching you in Nigeria university, they say, we are teaching you this because in case you go to the UK or you travel out of Nigeria, you might see this.
Yeah.
So imagine a village boy like me having to learn everything that are also taught in a developed society. That makes Nigeria unique in terms of energy they put into imparting information. That is why I keep saying, if we invest more in our education, we will solve a lot of problems in healthcare. Same. We, like I learned everything that I've never seen. So I come to the UK and now saw those things I learned. You understand? So there are some health diagnosis. There are some diagnoses, there are some health conditions, there are some problems. We will learn theoretically. But you come here, it's standard. You see it every day. That, this, okay. We talk about kidney stone, gallstone in Nigeria as if is devil punishment. But yeah, it's normal. You see it every day. Patient goes in, they said the stone is out. Patient goes home. So you are no longer reading about cholelithiasis, cholecystectomy as in theoretically. You now see it in practical. But you learn this thing first in Nigeria. I know a lot of nurses trained here in the UK that will be asking us, how did you learn this? I thought they said no good education in your country. Where you say, yes, we learn all of this, but it's in theory. You are learning because you are seeing
You're seeing it.
Yeah.
Do you feel that the training you got in Nigeria has given you an advantage over your colleagues here?
Yeah, a lot of advantage. Like be educated in Nigeria give you a lot of advantage because I know everything off head. The beauty of the UK system is you don't need to know it off head. There are available resource. You don't know about this. You have BNS. You have artificial intelligence. You have Medusa. You have a lot of resources in front of you. As you are doing your paperwork in your computer, you can click on this. Okay, please help me just check cholelithiasis. What does it mean? As you are doing, it come up. But back home, you don't have that. You need to know it.
You have to cram it.
Yeah, you just need to know it. That, cholelithiasis is stone in the blocking the channel. But yeah, you don't know it. There are where it's available, where you can get the information. I think that gives advantage, whereby you work here in the UK, you are able to come up with the information while others are searching for it.
You specialized in accident and emergency in Nigeria.
Yeah.
What are the realities of that in Nigeria?
If we are to use Nigeria standard to judge accident and emergency, the response in terms of the citizen response is near 1%.
1%?
Yeah, because there is no proper mobility, transport.
Can you give me an example of maybe one particular experience that you...
Okay, there was this accident that happened around Third Junction, thereabout, in Benin City. I know you may know, but the people who watch knows Benin City. So they were taking the patient to the hospital in UBTH, and the patient was dead on arrival. These are particular accident that the patient should be alive because he has a deep cut to the leg. But because he was sitting, he was in a position whereby the blood was flowing out. The patient died before he arrived at the hospital. That incident is common in Nigeria, that a lot of accident victims are brought in dead.
Were they brought in by ambulance or?
That is where the problem is. Improper mobility. Because there's no ambulance. Ambulance are manned by trained personnel that understand the importance of positioning. But you squeezing like they squeezed Anthony Joshua into the car does not help any accident victim at all, because you don't know where the accident is, where the problem is. It could be laceration to the leg, and then the blood is gushing out. It could be fracture. It could be internal organ being punctured, and then you keep moving the patient. you are causing more damage, the patient will not survive. That has been the major problem. And when you go to Nigerian hospital, you see that their accident and emergency has been reduced to where they see as outpatient. Accident and emergency is not outpatient department. The reason is people, the real accident victim that's supposed to come are not being able to access because there is no mobility. That's the issue. Then they have to now say, okay, we can't leave this department idle. Let's begin to bring in malaria. People with malaria come in, they see doctor, they get treatment and go. Then you begin to see a lot of unnecessary patients that shouldn't be in the emergency. Emergency department is for emergency, for people who need actual emergency care. And it's structured in a way that everything is available. There's laboratory, there's blood bank, there's theater, there's CT, there's MRI, there's X-ray. In that place, only for the emergency.
Yeah, to treat
but
them
if you don't
immediately.
have the patient, you will use it for others. And that is the reality, that in Nigeria today, if you have an emergency situation, 1% chance of survival.
1%
Chance of survival. Anybody can contest it if the percentage is higher. The percent, I'm very certain the percentage is not higher than 1%.
So you're saying if somebody has an accident on the road, 1% chance
of survival,
survival.
yeah. And
If
that 1% chance is because it's God, not because they did anything. Because conveying the patient to the hospital alone putting more risk of dying because there's no proper mobility.
When you really put that in mind, you're thinking if someone's child has an accident in a playground somewhere in school, 1% chance of survival.
Yeah. That means the 1% chance is based on luck that it was not severe. If it's severe like a broken rib, the chance of survival is 1% because the rib could, because of the malhandling, it will damage the lungs, and then more complication comes. The statistics are there. Over 5,000 people died from accident. And the type of accident that happen in Nigeria is the type that normally they are supposed to survive. Is in the Bureau of Statistics. Over 5,000 people die from accidents every year.
Yearly,
in the past year, that was actually 2023 through 2024. No, 2024 through 2025 reports. And the type of accident we are talking about is not plane crash. I am sure they are okay. We will say, I know some people will ask, what about the percentage in the UK? I know people will ask that. Oh, what about 1,200 died in the UK from accident last year.
Okay.
And when you look at those accidents, the chance of survival was low because of their age. You don't have 90 years old driving a car in Nigeria, but you have it here. And when you look at the statistics of accident happening in the UK, there are more 70 years and above. Okay. How many 70 years and above ride a car in Nigeria? Few. Very, very few. Very few. But it's common here. You hardly see a young man or a young woman in the UK have an accident and said he's going to die. I'm sure the percentage of young people, if you look at the statistics, is less than 1% of young people below 40 who had an accident and died. Is below 1%. The higher percentage of people who died were actually elderly people. Nigeria, what our life expectancy is 50.
50?
Yeah. So that means everybody who had an accident is possibly going to be below 50 years old. That means they have a chance of surviving. So how do you explain over 5,000 people dying from accident that naturally they should have survived?
When you look at it that way, I can understand why people run away from Nigeria.
Yes. Not only for the finance, for safety.
To stay alive.
To stay alive.
In Nigeria, many patients arrive at hospitals extremely late. Why does this happen so often?
Is the system. I know we have not talked about the system since we've been discussing.
Yeah.
That's another big aspect of the whole problem. If you leave the UK today and go to Nigeria, in 3 months, you begin to behave like Nigerians. So if a Nigerian leave Nigeria and come to the UK, in less than 1 week, he begin to be punctual. It's a system. Okay. When I came to the UK to write my OSCE exam, my friend told me that in this country, if you late more than 1 minute, they won't allow you. You understand?
Yeah.
So I will go before, let's say my exam is tomorrow, 8 a.m. I will leave today, lodge in a hotel close to my exam center so that because I don't want. But you see that immediately there was a switch because the system, that's how it's built. So our system is built on lateness and laziness. I know people will say, no, this is not about shades, casting aspersion, negative aspersion, anything. Look at, I'm involved in politics. An aspirant will tell you, I'm going to be there 10 a.m. We will go to wait for him 8 a.m. He will come by 4. And that same politician will win an election, and you think he's going to do good?
When you say 4, do you mean
4 p.m.?
Okay.
Has
this happened?
Rally will start now. Make sure you are following and see the time. Okay, let's give an example that is more obvious in the news. You see the way Obi usually go late to all the events.
When you say Obi, do you mean
Peter Obi go late to all the events? Is in the news, is in the media. Everybody's usually see. We usually talk about it. Why is this man always coming late? It's not that he's the only one doing it. That's how all politicians.
the system?
So the system. That's how the politician came from us. They go through us. Doctor come late to work. Nurses come late to work. Patient come late to appointment as well. You see it. You will go to a hospital, you come early because you have an appointment. They'll tell you your doctor have not arrived. The laboratory has not opened. It's the system. That's what we are saying. We are not shading anybody. It's not only Obi that is going late. Go and check other politicians. Check when the only person that is not mostly on camera for coming late is the president. It's not that he's not coming late as well. He's not always on camera. Because it's when he comes that they will say
they will start.
We want to start. But when you look at the event planning, you see that they are supposed to start by 9, but he came here around 12 because he's the man. So they have to start when he arrived. Unlike the others, whereby they had to start. It happened in other rally ground as well. We are being involved in politics as well. We will go and we will wait for this politician to come. Those are obvious examples. But it happened in all sectors. It's the system, it's the Nigerian system that is faulty.
I feel like it's a blatant disrespect of whoever is waiting for you to just show up late.
Yes, because you are in the UK. If you are in Nigeria, after 3 months, you begin to see that being late is normal because you are not expecting the patient to come on time. So the doctor is not coming on time. If you, as a UK resident, you come to Nigeria, you say you go for appointment and you come on time, you see that you wait for the next 2 hours or more before the doctor will come. The doctor will ask you, how long have you been here? Because he's surprised that you are punctual. It's surprise. A few people are really punctual. Are punctual in Nigeria that I know. The only since apart from few of my tutors in school that were really punctual, a lot of them were latecomers. Me too. I was a latecomer while I was in Nigeria, but since I've been working here, I think I've only went to work once late, which was like 5 minutes, which is even exempted. In my workplace, 5 minutes is the man. If you send a message that, oh, I'll be late, it means you will come 5 minutes.
5 minutes
it's
late.
not more, yeah.
Wow. What are some of the cases you've witnessed that show the consequences of poor healthcare infrastructure?
A lot.
Can you give us maybe 2 examples?
We have seen a patient die because there was no blood available. This is still happening today. We are not even talking about the current one. These are things that happen every day that we cry and forget about it. Family cry, and then we have seen this. The one that shocked me most was a patient was taken for CT scan out of the hospital because the one in the hospital, I don't want to mention the hospital name. It's a big hospital in Benin, Federal Hospital. The CT scan in the hospital was faulty. They said, okay, we need this CT scan. Okay, there is a place in Sapler Road. Let's go and do the CT scan. The patient died on the way.
Did they get sued for it, the hospital?
It's part of... These are things that happen daily. These are things, if it doesn't happen in this fashion, it happens in another fashion that leads to the loss of life. So, why are these things happening? It's still about policy. Who are you going to sue? Is it the doctors? Is it the nurses? Is it the sonology or the radiology? It's not their fault. If it was available, they would have done it. But we are talking about education. 75% on education, people think is outrageous, right? But you know that biomedical engineers, they are produced via education. How many are in Nigeria? We only have 2 institutions that are offering that course. Are they being sponsored heavily to really produce? You know what biomedical engineering does?
Yeah.
They are the ones that repair the equipment. They are mostly from India and China.
Importing them.
Yeah, and they are paid heavily to do the job.
An amount they'll probably never want to pay any Nigerian.
You can't. The biomedical engineer and Chinese I know in Nigeria, in Edo State, is collecting 5 million per month.
Isn't that how many times the salary they're paying you?
In fact, that salary pays everybody, both doctors and nurses that work in the organization. I don't really like to be sensational, to just say things that are unfounded. People that are in healthcare, if they watch it and they see I've been outrageous in my comments, they can come up with evidence to dispel what I've said. About medical engineers, 95% of them in Nigeria are either Chinese or Indians, and they are paid in equivalent of dollars. Because we don't have the institution producing these experts. You understand? So, it's the same way, because they need to stay in the country. They are expatriates, as we say. They are also immigrants as well.
They'll probably be given houses, drivers,
giving a car,
cooks,
a driver, cooks,
cleaners.
everything. Yeah, that's what it is.
So it's just a bit annoying hearing that they're being paid that much. And
yeah,
I think we've kind of touched on this question.
Okay.
I was going to ask, if someone had a heart attack in Nigeria versus the UK, how different are the chances of survival?
Yeah, in the UK, it's about 75% according to statistics.
Of survival if you have a heart attack.
Yeah. But in Nigeria, without no evidence, no available statistics. Based on my experience, it's about 2%.
At least it's higher than the 1% you said before.
In accident case, it's 1%. In heart attack, the thing about heart attack is it gives you signs. So if you know the sign, if you get the sign, because when we say attack, it's defined as sudden cessation.
Yeah.
But when you look deep, the issue will be giving you signs like shoulder pain. When you are sleeping at night, you'll be having a hiccup. There are signs that you will know that it seems something is not right. At night, you won't have sleep. There are signs. You didn't drink. During the day, you'll be drinking a lot. At night, you'll be passing a lot of urine. Those are signs. So anybody who understands that what is happening is not right can actually immediately go. That's why it's 2%. But in the event that it happens already, it's 1%. Because we are not talking about how to get the person to not die. To not die, yeah. Because a lot of things need to come in after that. No ICU. How many ICU are in each state? And it's expensive to admit a patient in ICU in Nigeria. Deposit 5 million.
5 million
Yeah,
naira
deposit.
to be admitted in ICU.
Yes, you can verify it. To be admitted in ICU, deposit the 5 million. It's only some few hospitals, federal government hospital, they will have like maybe 4 beds in the ICU for adults. And it's always full. So private, they charge because the work needed to get the person to really manage the patient is enormous. And it's 50-50 chance. They will tell you sign that it's 50-50.
You pay 5 million for 50% chance of survival.
Yeah. And once a patient have a heart attack, the productivity of the person is already 50% gone. That is why the education also is important. Because it's via education that somebody knows that, oh, this sign I'm having, I need to see a doctor. That is why free healthcare is important, because you need to get the needed care you need for free so that it will be motivated to get to seek for help, right? But if any of this is not available, our life expectancy will not go up. I don't want to say it will go down. It will not be up. We see a lot of 90 years old patients here in the UK, 95, still working.
Do they come in by themselves or
Yeah, they drive
to the hospital?
Yes, a lot of them. I'm not saying all of them, but a lot of 90 years old plus drives in the UK and come to the hospital for treatment, drive home when they get well. Is it out of providence? God loves them too much? No, it's because the education is sound, the healthcare is sound. The patient knows when to say, okay, I need to go and see a doctor. Oh, the way I'm feeling, I think, I'm passing urine too much. I don't sleep at night. I need to go and see a doctor. And then there's a facility to say, let's do troponin, let's do CT, let's check the heart. The doctors knows where to. The beauty of it is there are many Nigerian doctors in the UK. The way we see many nurses in the UK as well. That's to say, we know what we know.
Yeah.
It's the equipment that we need and the money to encourage us to get the things done.
And like whenever I go to the hospital, I always see you see so many Nigerians, see so many Indians.
Yeah.
And then you really think to yourself, it's because we have that knowledge.
It is.
But unfortunately, a lot of our knowledge is just being wasted.
Back home,
not valued.
It is. And the UK, one thing fascinating about this country is everything is systematic. They are not afraid to take a nurse from Nigeria for any country. Not because of anything. They know their system will train you to be able to have the necessary knowledge, necessary confidence to get the job done even when nobody's looking. Patient will have confidence. Do you know that patient will know if you are new?
How?
If you are new, patient will know. That's where the level of intelligence comes in when we are talking about education. It's out of education, he knows that the way this person is, he must be new. The level at which a nurse operates is higher than this. Because when you are new, you have language barrier. No matter how you speak Queen's English in Nigeria, when you come here, you have to learn the art of communication.
And what does that mean? It doesn't mean, because I know some people think that good communication is speaking with accent.
No.
But throughout this whole conversation, I've not heard you do shwang, shwang,
No. Communication is a different ball game. Communication is being able to be understand. You understand the person understands you. You pass a message, he receives it, he understands, he gives you a feedback. That's communication. It's not about diction. In fact, I've not heard British people speaking heavy lexicon, using heavy lexicon, and all of that. They speak regular English. In fact, you don't have any reason to polish your accent. Make sure when you speak, they hear you.
And you're understood.
And they understand what you are saying. If they don't understand, you ask again, you re-explain. So when you are doing all of this, that's when the confidence, they begin to know that, okay, when you cannot do all of this, they will ask, how long have you been working here? You say, I just came here. Oh, I know. Please, can you call me your nurse in charge?
Yeah.
You have not done anything wrong. They already know that you don't have the prerequisites to really attend to their needs at the moment. Not because you are a bad professional. Communication is a big deal here in the UK.
And not because you're using Nigerian accent.
No. It's just because as a Benin man, it's easy for me to think in Edo language. Yeah. So, you begin to think in English. You can't really communicate in English. That means even while you are alone by yourself, you are thinking in English. That's when you begin to communicate. Because the question you are being asked, you didn't prepare for it. You have not heard it before.
Yeah.
And they throw you a question. You need to now process in split seconds to come up with the right word, the knowledge, you know it, then you are saying it, the patient is understanding and is giving you feedback. Those process is communication. And it takes time to get it. 6 months, 7 months, 8 months, you see that you as an individual begin to communicate with yourself in English. That's when you begin to now flow in English. If this interview was made when I was 3 months in the UK, maybe I would have been speaking Benin. Because I was still thinking
in Benin
language. Yes.
Because that's the language you're hearing around you, because that's the environment you are living in.
It is.
Thousands of Nigerian doctors and nurses are leaving Nigeria every year. What's the reason for this?
It's money. Let's make it simple. It's money. Nothing else.
Some people say that healthcare workers leaving Nigeria are abandoning the system, while others say that they're escaping it. What's your honest view? Are they abandoning?
We are escaping it, not abandoning.
You're escaping the system.
Every nurse, every doctors trained in Nigeria are passionate to work in Nigeria because it's our people. It's our brothers and sisters we're talking about. So it's not abandoning. If I'm being paid right, why will I escape? I ran. I did not abandon it. I said, I beg,
go away.
I don't want you. I want to go to no. It's because the money was not enough to really take care of me as a person. Because I was a person, I said it earlier, I was a person before I became a nurse.
Yeah.
So I have that. I have families, I have brothers, I have things to do.
You have responsibilities.
I have responsibility. And the job I'm doing should be enough to do all of that. Not a nurse being fashion designer, caterer, event planning, just to subsidize. In the end, why is he not a nurse? He could actually just quit and face this, right? So in the UK, how many people do 2 jobs in the UK? Like, you'll be a nurse, you'll be driving Uber. It's almost impossible. Because what you are earning as a nurse is almost enough to do everything you wish to do. That's it.
What would Nigeria have to change to convince healthcare professionals to stay?
Good question. Policy. Policy, again, policy. Everything is policy. Nobody is dull. Nobody is impassionate. No healthcare professional, no nurses is impassionate about Nigeria. If you talk with thousands of Nigerian nurses and says, if they pay you well in Nigeria, will you go back? I'm sure 90% will say yes. Not because we are tired yet, because that is our country.
Home.
So if they get the policy right, which I have highlighted, policy of free healthcare, I'm sure many people will put their money. Let me give you an example. Alakija just built an hospital worth billions.
Wow.
Do you know what he did? He gave it to the state to use. Just take. Most people will say it's philanthropy. Yes, it's philanthropy. But the bottom line is, we that are inside knows that it's not easy to run a healthcare facility when the return on investment is not guaranteed. So do it, let it be on record. Because if you decide to say, okay, no, except you want to be treating people for free.
Yeah.
But if you decide to treat it as business, it's going to collapse. Because every equipment you buy, you are buying it outrightly. That means you need to make the money to replace it if it got bad. So if you don't have the money, it means the hospital will stop having CT scan, right?
Yes. Well, I just hope that the government is able to maintain that hospital and actually, just keep it okay and not just run it down.
I pray so. Now we are not talking about prayer.
Well, that's why Nigerians rely a lot on prayer.
Instead of really talking about policies that will make it function optimally, what will make that hospital function optimally is to say everybody have free healthcare. You will say that the place will be packed full. And when you treat, you get the money from the coffers of the insurance company. Then you can now buy equipment, you can now maintain the place, you can now pay your light bill and all of that. Buy drugs. Then companies can now say, no, instead of you buying and paying, I can actually produce, supplies you. You begin to pay me monthly.
For it,
Then you are creating jobs. If you say, let's discuss the healthcare of the UK, that's another topic on its own. But if we understand it, you see that it's because Nigerian politicians do not really understand how healthcare happens in the UK. That's why they are doing the way they are doing, because they want to approach it as a capitalist. Oh, everything is money. When you have 133 million, over 133 million in multidimensionally poor brackets, and yet you said you want to take care of them as a capitalist, that means I will set up an hospital, I won't have clients. I will set up an industry to produce hospital equipment, nobody will buy, because hospital without clients cannot buy equipment, cannot buy drugs.
It's like a business without customers.
That is what it is.
Nigeria is Africa's most populous country.
Yeah.
Yet its healthcare system struggles. Where do you think leadership has failed the most?
Nigeria is the most popular black nation in the world. So if we put it in African context, it's like we are dealing on the African scene. You understand?
Yeah.
Okay. Leadership had failed in every aspect of Nigerian life. You understand? If we're going to give timeline, many people, they call them Gen Zs, do not really know where we are coming from. I remember in the 90s, 1998, I was in JSS 1. School fees was 750 naira. Wow. A basin of gari was 60 naira. That means you need to sell a lot of basin of gari to pay one school fees for a child. Now, if you now have 3 child, that means you will not be able. Then 2000, there was an economic boom of the millennium, the biggest we have seen so far. There were crude oil price rise. Everything went up. Basin of gari from that 16 naira went as high as 1,000, and when year 2000 we're ending 60 to 1,000. How many percentage increase? That's to say every other sector received the boom. But what do our politicians do with the money? They call it excess crude fund. If you check Google, if you ask, they call it excess crude fund. Obasanjo were sharing it with governors. Governors were embezzling the money. So those are what they should have used to develop the future. You know, Nigeria, when they want to do road or do anything, they will first of all ask how many people are in that area at the moment. Let me give you an instance. Let's say you are in Benin. They want to tie one road. They will first of all ask how many people are resident in that community before they do the road. And then after that, they will say how many people are voting in that community.
Why does that matter?
Okay. That's to say they don't have vision for the future. They don't think about what about 50 years' time companies want to come here
and set up there. Yeah.
They will need road. Why don't we at this moment we have the money do the road? Now look at
for the
it.
Future.
At that time, a bag of cement was less than 500. Now it's about 12,000. So we are paying times 1,000 to not get the same thing we should have gotten in the year 2000. That's to say, in summary, the leadership failed at every given time to plan and implement. In fact, there was no planning, let alone implementation.
So is there no time that the government has, maybe there was a time when there was a particular president that made things run better in Nigeria? Like, I don't know, Abacha, something.
If we say, I think everybody will have their own opinion based on the timeline they live. If I live in the 60s, in the 50s, maybe I will say, in the First Republic, things were better. But since I know about Abacha, before Abacha, Babangida, Abacha, and the rest come, nothing. We've been going down. I remember my uncles, and a lot came from the UK to come to Nigeria to work. I had a patient in Lagos that said he was working in what they call NEPA in the UK.
Wow.
So when Nigeria got independent, they came, they were the one that said that was the first employee of NEPA, indigenous who have expatriate experience.
So they left the UK and went.
They left the UK and come to Nigeria.
Wow.
They will tell you that since then, Nigeria has been nosediving in terms of the kind of policies, in terms of the kind of implementation, what we put our effort on, a lot of that. How can a government be thinking about having billions in foreign reserve, and then we can't have basic things at home. Then politicians will tell you foreign reserve is necessary to rate the buying, purchasing, and the loaning power of a country. Are you loaning, or you have the money to really start doing something on the ground? That is a big issue. I was talking with my friends. I said, if government are serious, it's easy because we have a template to follow. People that have done it, made mistake and get it right. We don't have to make the mistake, and we don't need to experiment. They have done the experiment. Like in the UK, when UK developed, they were running as if they were socialist government, right? They employ everybody. Companies were running. Then they will employ road workers that construct the road, pay them salary to do it. But what would Nigeria do in their own? They are giving the contract out
to their friends.
To their friends, to people, they call them Oyimbos. We call them expatriates, just to give them. They are also immigrants.
Yes.
To start doing. Whereas we have millions of us on the street without jobs, and a lot of engineers in there. That's a problem. So the money you are giving as expatriate in dollars, you can actually say, okay, that also comes in is education and the system. They know that if you give these people to do these things, they'll get it wrong because there's no system to follow. Here in the UK, they give you a job. The CEO will go home. He's sure that you get it done.
Yes, because there are consequences.
You on your own, you just want to even do it better without nobody looking.
If Nigeria was committed to reform today, to reform its healthcare system, how long do you think it'll take for us to be able to have a healthcare system, maybe like what we have in the UK, or just basically a functional healthcare system?
Functional healthcare system. It's going to be instant.
Instant.
You know why I say it's instant?
Why?
Go to Nigeria and say you want to do a free medical checkup. Everybody will line up. That's to say, if you say from now on, we're going to have free healthcare, everybody will start using that facility. You think nobody comes. So if we are committed to reform and say from today we're going to be doing free healthcare for every citizen, I am sure, definitely sure that we're going to start having results immediately. Secondly, investors will come in the next day. I'm sure people will say wherever their money is and say, let's go to health because it's the new gold mine.
Even international investors.
People will come, even the companies producing equipment will come to Nigeria to say, we want to produce here and serve. That's why I'm very certain that if we have the right policy, like free healthcare for all, we'll get our healthcare right.
Mr. Osawaru, are you a religious man?
Yes.
What particular religion do you practice?
90% traditional religion, 10% Christian. The 10% Christian is for the social status.
Okay.
Well, the question look deviating, but however, any Benin man that tells you he's a Christian is lying.
Okay.
If a Benin man tells you, oh no, I'm a Christian, he's lying. Or he doesn't know himself.
The reason I'm asking you this question is just to know, okay, as a 10% Christian and as a healthcare professional, how do you feel when you see so many Nigerians praying to God about healthcare situations that could easily be treated in a society that has a proper healthcare system?
Okay, that's a good question. And the answer is, you call what you know. You use what you have.
What do you mean by that?
We don't have healthcare system that is functional, so you cannot call. Imagine somebody has an accident. You are supposed to call an ambulance if you know it's available. But if you know it's not available and what is available is God, you call God. That is why you see that something happens, people are calling God. But when you come to sane society like UK, where ambulance, you see that people are calling ambulance. Not that God does not exist or does not hear prayer, but that is not the first go-to area. Choice, I mean. The first choice is ambulance. Oh, let's call ambulance to get this person to the hospital. Let's call police so that they can make sure everything is safe around here. They go to their house. We see it happening every day in Nigeria, whereby somebody just slumped, then the next thing is they are praying. Whereas somebody slumped in the UK, they call the ambulance. So that is the explanation, is you use what is available.
You use what you have.
Yeah.
So from your experience working in Nigeria, what is the emotional toll that nurses or doctors face working in a system where they know that they could have easily saved somebody's life if there was oxygen or if there was blood or if there was this machine? What emotional toll does it take on Nigerian healthcare professionals?
A lot. It takes a lot from us, to be fair. Because I've seen a situation whereby nurses make donations, doctors make donations to buy drugs, buy infusion for patients from our little salary. Because we think this is the best way we can help these patients. It's about this our people. And this patient could be well and go home to contribute to the economy, but he's here because he can't afford it. So every day you go to work in Nigeria, you definitely going to see something that will break you emotionally. Not because somebody hurts you. It's because you are hurt seeing people who could be contributor to the economy lying on the bed because they couldn't afford it.
Are you ever left with, or were you ever left with traumatic memories that stayed with you for life?
A lot of time. Seeing what you could have done better if we had this, if we had that, that patient couldn't have died. If we were able to get blood, if we were able to do that investigation, that patient would have been alive. A lot of us carry those scars, not in our own making, but because things that should be available are not available. And then you go home with tears, with pains of, oh, that lovely young man just died because things that should be available are not available.
And you had to watch them die.
It's just heartbreaking. A lot of time it happens. You hardly see, the problem is you hardly see somebody dies because there was nothing that could be done in Nigeria. You hardly see. Unlike we come here, you see people that died because everything has been done. But back home, you see people die because we couldn't do more. Because there's still something that could have been done, but there's no way we
Could have done it. Yeah. I think my final question for you is, if you were the Minister of Healthcare in Nigeria, what would you do differently?
I will push for free healthcare. Free healthcare. That, in my observation, my understanding of the problem we have, is going to be a game changer. Then we'll invest some of those money on education. Because even the healthcare professional need training. The patients need training as well. They need education. That is how it is. If we are able to get these things right, free healthcare, then invest the funds on education. I don't see any reason why there should be a difference between Ministry of Education and Ministry of Health. because even in education, even in health, there's
there is education.
So they should work hand in hand. So if I'm a minister, that is those two. I will not be concerned about building blocks and painting. Just focus on getting this policy done, and then we set up a system to run it properly. Because in sane society, it's not government that build hospitals. People don't understand. It's not government that build hospital. It's private people. Hospital is real estate that are given to managers who then meet companies to supply equipment. And then patients are there. When you manage the patient, you go to the insurance to get the money. It's simple. So why would government be focusing on building blocks and painting it when they can get the policy and make people to come in?
Wow. Thank you so much, Mr. Osawaru Enoruyi.
Thank you very much.
It's really been enlightening listening to what you have to say, and honestly, hearing the amount of pressure that you healthcare professionals go through every day, especially the ones back home in Nigeria. It's heartbreaking. Yeah. It makes one angry, and it makes one wish and hope that things could just be done differently to make you guys do your job better. But thank you so much for making our time to be here today.
I'm grateful.
Do you have any last words of encouragement for your fellow, what should I call them, colleagues back home in Nigeria? There's your camera.
Oh, my fellow colleague back home. Yeah, study hard, be passionate. If it's possible, come to the UK, go to America, go to China, go to Canada. Get the money, then we can come home and see how we can help the situation. And secondly, we need to try to continue to lend our voice to positively impact our society in Nigeria, so that the government will not only be hearing about social media frenzy and sensation, then they will also be getting the real information that can influence their policy making.
Thank you very much.
Thank you.
And thank you very much for watching. If you enjoyed that conversation, please leave a comment below and let us know what you think about what Mr. Osawaru has said today. God bless. Thank you.